America's healthcare system is failing, mostly because large healthcare corporations are making it impossible for underprivileged Americans to get decent care. I have attorney Ben Gordon here to help explain the problems of corporatized medicine. Ben, I think the medical profession is finally figuring out that corporations are now involved with every decision that they make when it comes to patient care. I mean, they no longer have their practice. It's run by MBAs, graduates from MBA school who have no medical background running medical practice these days.
Yeah, it's amazing. You know, some of us remember Marcus Welby, MD, and I think the days of the true solo practitioner who is able to really care for his patient in a well-rounded, humanistic way are gone. You know, these corporations, these hospitals that are buying up these medical practices are setting the physicians up to be at a conflict. I mean, how can they look as their number one goal just to take care of their patient if, in fact, their compensation is based on whether or not they bring a lipid down to a certain level by prescribing a statin or bringing sugar down?
Okay, let me talk about some examples. How is it done? An MBA tells a doctor, they give them a corporate guideline. Is that kind of what we see here? It's literally it's a corporate guideline written out step by step about what a doctor can do and what a doctor can't do. A doctor, for example, may in the past have wanted to spend 30 minutes with a patient, and the MBAs now tell them, no, you can only spend 15 minutes. Lay out how much in control corporate America is.
Well, I mean, it's pervasive. I think the AMA's own statistics show that between 2005 and 2010, the number of physician-owned practices versus hospital or corporate-owned practices declined from something like 70% owned by the physician down to well under 50%. So more than half of the practices in this country are owned by the corporations, so the corporations control everything. They tell the doctors how long they can spend. You know, people who don't even have, in some cases, a four-year degree, much less a medical degree, are making, bean counters are making decisions for physicians on whether they should see a patient for a certain length of time and whether or not they should prescribe a certain therapy based on how much it benefits the hospital.
Okay, well, we used to hear that we thought that was going on. Now the studies are very clear that that is what's going on, that we have somebody in New York making a decision for how somebody can care for somebody down in Florida, making a telephone call, say, doctor, you're spending too much time with patients. You are not, for example, you mentioned statins. Lay that out. In other words, a doctor is ordered, you must prescribe a statin because you don't want to spend the money on alternative type of therapy. Explain how that works.
Yeah, and that's a great example. Lipid-lowering drugs, statins as they're called, such as Crestor and Lipitor, have not been proven safe. They cause a lot of problems, and yet that is the one benchmark that physicians are told to use in their practice. If a man reaches a certain age and has slightly elevated cholesterol, they automatically give them that statin, and the reason is that benefits the doctor and the hospital financially to prescribe that drug, which costs them very little, which the profit margin is very high, and in turn the patient may or may not have his entire picture looked at. The doctor may not really be looking at other factors such as diet and exercise and smoking, and just in and of itself prescribing that statin in order to try to get the cholesterol down to a range that there's no real evidence that suggests that will make the person less at risk for heart disease.
Okay, so the corporate, and again, I can't stress this enough, these are actual corporate guidelines that you've seen and I've seen that lay out specifically how long a doctor can spend with a patient, no matter how critically ill the patient is, what the doctor must prescribe, no matter whether the doctor makes the judgment that this is not the thing to prescribe or not, and if they don't do that, they're financially penalized. Isn't that the way that it works for a doctor under the new corporate-run hospital?
That's right.
Isn't that kind of where we've headed?
Exactly. The hospitals control the decisions. The hospitals tell the doctors, your bonus will be based on whether or not you prescribe enough of statins, on whether or not you prescribe enough of the sugar-lowering drugs, these new ones like Byetta and Januvia. If the sugar of your patient is slightly elevated, you've got to give them that drug. Your financial independence may depend on it. And what's the doctor going to do? The days of being a doctor being able to sit back and look at the patient's entire profile and decide what's best for them holistically and in a broad-based medical, scientific-based approach are gone. They have to prescribe the drug that's going to get those numbers where the hospitals want to get them.
And if the doctor determines that the patient doesn't want to buy, for example, a lot of people understand statins are poison. They don't take statins. And a patient may say, I don't want to take a statin. They actually end up firing the patient rather than saying, well, here's some homeopathic kind of alternatives for lowering your cholesterol. A patient is fired, and the doctor is fired and or penalized by the corporation that now owns his or her practice. And the loser really is just the patient. I mean, the loser is the patient. And at the end of this story, it doesn't appear that that's going to change. Matter of fact, the numbers are increasing. Ben Gordon, thank you for joining me. This is a story that we better pay attention to if you are planning on having any medical care in the future. Thank you for joining me.
No question. Thanks, Pat, for having me.
That's it for this week's Ring of Fire, but you can keep up with us throughout the week online at ringoffireradio.com or on Twitter at Ring of Fire Radio and on Facebook. I'm Mike Papantonio. We'll see you next week right here on Ring of Fire.
Columbine,
Virginia Tech,
Tucson,
Aurora,
Fort Hood, Oak Creek,
Newtown.
Newtown,
Newtown.
Newtown.
how many more?
How many more? How many more colleges? How many more classrooms?
How many more movie theaters?
How many more houses of faith?
How many more shopping malls?
How many more street corners?
How many more?
How many more?
Enough.
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 Demand a plan.
Right now. As a mom.
As a dad. As a friend. As a husband.